Welcome to the Worcester Senior Center and UMass Fall Prevention, where we celebrate autumn, not fall. Yay! No falling. No falling. Today we welcome the UMass Med students who are here today with Linda Winsek Moore, Senior Service Manager, learning all about what we do here to assist you. Thank you to the Casella family for their generous donation of decorations in memory of Paula Casella, who was a former ESWA volunteer, and decorating was one of Paula's passions. Another shout out to Dot Sweeney and Shirley Lyon for their special efforts in beautifying our lunchroom, as well as our anonymous centerpiece donor. And lastly, a big thank you to Pamela Hines, pianist extraordinaire, for providing the entertainment during lunch. We also include our sponsors today, who include UMass, thank you Dominic and Asia, Fallon Health, and Salmon Health. Our first distinguished speaker is Pablo Maldonado-Pinuer. I believe some of you are his patients. He is director of the Balance and Vestibule Center at Greendale Physical Therapy, a board-certified physical therapist with 15 years of experience. Pablo will be followed by our beloved fitness instructor, Rhonda Hammer, big round of applause, who is a personal trainer specializing in senior fitness, functional aging, balance, and posture, and other related areas. Welcome, Pablo and Rhonda.
Hello, everybody. Thank you for allowing me to be here. And however, I have to say that Suki forgot to mention that I'm an only child. So there's no way I can go through this presentation without talking about myself. So when I was in, I want to say 6th grade, I think I was 11 years old. I can't remember. I didn't study in the US, so I don't know the times. I was on the assembly line in school, and I started to get dizzy. Like the room was spinning, I was getting nauseous. I don't remember the details, I just felt awful. And I had to excuse myself from the line, and I went and I vomited. That happened a few more times at school and at my home too, until my parents took me to the hospital, right? And the doctor said, oh, he probably has vertigo, but he might also have a brain tumor, right? Maybe he's having some type of little stroke. And if they tell you that your 11-year-old kid has a brain tumor, that's pretty alarming, right? And he said, you might want to have an MRI, just in case, right? To give you context, this is Chilean Patagonia, the tip of South America, very isolated. We didn't have an MRI machine in my town. Today we do, but back then we didn't, so we had to fly to another city because between my town and the next one, there's a whole glacier. So you can't just drive, to the next town. You have to fly. And this is the 90s, more expensive to fly, more expensive to get a hotel. So there was a whole situation just to rule out or rule in that I had vertigo. So luckily I didn't have a brain tumor. I wasn't having a stroke. I had vertigo. Uncommon in children, but I did have vertigo. So there was some peace of mind there for my parents. And I'm not trying to tell you this story to sell you, oh, that's the reason I became a physical therapist that works with vertigo. I didn't know PTs could work with vertigo until I was studying. But it's mostly to acknowledge and remember that when the room is spinning, when you're falling, when you're throwing up, it gets scary. And many of my patients, when they come to see me, they haven't got the right answers about what's happening with them. And many times they are in the office thinking that they have a brain tumor and nobody told them. Nobody has figured it out yet. Luckily, most times in the office, we're able to give them the answers that they need and the right treatment. Now, a very simple definition for vertigo would be that there's the perception that the environment around you is moving or is spinning, right? It usually comes from a problem in their inner ear. Not always, but most times that is the issue. And I picked that picture of a big umbrella because that's what vertigo has become, an umbrella term, sometimes from many other conditions that might mimic vertigo, but they're not the same. Right? Sometimes it's very useful to differentiate what is the problem in order to provide the right treatment. For example, we have vertigo. We talked about that already, right? We said it's the sensation that the environment around me is spinning, right? But sometimes I get people that have plain disequilibrium. Basically, they feel imbalanced. They feel unsteady on their feet. And that can come from many reasons. Usually, if my joints are stiff, I'm going to have a hard time with balance, right? If I have neuropathy on my feet and I don't feel them, therefore I'm tripping with my feet, I'm going to have a balance problem, right? Or if I'm weak, if my core is weak and I even had a hard time getting up from my chair, I'm going to have a hard time walking too, right? So not everybody that has disequilibrium has vertigo, right? However, if you have vertigo, you're going to have disequilibrium, right? If the room is spinning, you're probably going to lose your balance, correct? The other thing that gets confused with vertigo is lightheadedness. Most of us have been laying down on the bed or sitting down on the couch and we get up too quick and whoa, right? We feel almost like we're going to pass out. That sometimes has to do more with blood pressure than actually having a vertigo problem. So it's not the same. And it happens a lot in hospitals that people, are hospitalized, they get them up for exercise, and they feel lightheaded, and they immediately want to schedule a vestibular or a vertigo evaluation, when it was just, let that person rest a little before they get up and walk. So you don't have to go through the whole vertigo situation. Now, all of these, regardless what they are, they're all going to affect your balance, and they're going to put you in a risk of fall. So it will be useful still to have all of those checked. Now, we're talking about balance, and balance can be so complex physiologically, but when you think about it, it's actually pretty simple. So my brain is in charge of my balance, right? My brain has to quickly decide what part of my body, what muscles, what joints to activate so I can fight gravity. Right? If we decide to stand on one foot, you're going to notice how your ankle is working to keep you there. If I turn my head, other muscles are going to activate too. So it's a game, it's a play that my brain has to do between what muscles I relax and what muscles I activate, so this person doesn't fall when they're standing on one foot, when they're walking, when they're running. But my brain needs information from outside to decide what to do with my muscles. And one of those sources is my inner ear, right? It looks like a snail, and then it has 3 different canals. They're gonna detect motion in different directions. The motions that my head is doing, and that information is gonna go to my brain, right? It's made out of membranes, it has liquid inside, and I'm sure some of you might have heard about crystals that are inside the ear. We're going to get to talk about those crystals later, but again, that information, that head motion, goes to my brain, right? Sometimes some people will have a problem in the brain too, and that is going to cause vertigo, but most cases is out here in the ear. It's not as big though, it's the size of a dime. It's right all the way inside beyond my eardrum. Also, another source of information is my vision, my eyes. If I can see the environment around me, if my brain can see the environment around me, it can decide how to move as well and how to maintain balance. I'm sure some of you have noticed if the lights are off or it's dark inside the house, it might be harder to, you might feel more unsteady. And that's because vision can compensate for balance problems. Interestingly, the vestibular system, when it goes to the brain, the cerebellum, right on that yellow area, Then it sends information back to my eyes. And my eyes and my head can move independently. I can look at Gail over there and move all the way around. I can, pick up something from the floor as I look at Gail, but my eyes can still stay at Gail, correct? If I lose that reflex because I have a problem in my inner ear, then every time I move my head, it's gonna feel like the whole room is moving with it. Have you ever seen a camera or a video from the 80s or the 90s? If the person was shaky, the whole picture is shaky, right? It's kind of annoying to see. You're like, I'm kind of dizzy with that video. But today, cameras have a system like electronic stabilization, the new camera, so I can be all shaky, but the image is going to be steady. This is what my brain actually was doing, keeping the image steady regardless of how I move or what I'm doing. How is that useful, though? If I'm in the supermarket walking, I can just look around for my groceries, and I don't feel like the whole supermarket is moving around me, right? That's why vision is so important for balance, because it keeps me steady. It keeps me fixed on a target. Another source of information, my joints, particularly ankles and upper neck. We have receptors there that will tell my brain how a joint is positioned in space. That's why I know when I'm walking on uneven terrain or in flat terrain. I know when I'm walking on the beach or on the grass. And if I twist my ankle a little, my body corrects, right? Those are different sources of information, and all of them tell my brain how I'm moving, what am I doing, or how am I moving in space. And then my brain, as I said before, decides how do I maintain balance? How do I avoid a fall? See, very, very simple. So again, that's inner ear, a little bit more of a detailed image, right? Do you see over there that yellow part? That's my vestibular nerve. That's how the information from that inner ear is going to get to the brain. I have membrane, there's liquid inside, and I have crystals. I have those little cells there that every time I move my head, those cells are going to tilt. And something that helps the tilting are those crystals, calcium crystals that are on top. So if I turn my head to the right, those cells are going to tilt to the right, and now my brain knows, oh, Pablo is turning his head to the right. And again, it's going to adjust balance according to that. However, every so often, those crystals get detached and new ones get formed. The problem is, in some people, or at some time in their life, those crystals don't get reabsorbed right away. They're supposed to be reabsorbed by that liquid that is inside the inner ear. If they don't get reabsorbed, they stay in there and they start bouncing around. So now every time I turn to the right, following the same example, the hair is tilted. Okay, the brain says Pablo is moving to the right, but now the crystals are bouncing around and are hitting those cells. And now those cells are, oh, Pablo is still turning, but I know I'm not, right? Remember I told them my brain had other sorts of information? My brain knows, okay, his feet are telling me that he's not spinning, his eyes are telling me that he's not spinning, but the inner ear keep insisting that Pablo is spinning. So if I am not spinning, my brain has to come up with an explanation. Oh, the room is spinning. It's not him, it's the room. And then I get this vertigo sensation, this illusion of motion. Because of those, again, those crystals bouncing around provide an extra information that nobody was asking for. Now, what I describe is one of the most common forms of vertigo. I've been doing this for years. I still have a hard time pronouncing that whole thing. Benign paroxysmal positional vertigo. It's just BPPV. Don't worry about it. Just BPPV, that's way easy, right? Usually an easy fix. Most people need a couple of sessions in therapy and they do fine. However, sometimes there's something called labyrinthitis, which is the inflammation of this whole system here, sometimes a virus, and people will have vertigo too. There are no crystals there. It's very intense, very debilitating, but you just have to wait it out until the inflammation goes away. And be careful of not just getting up and moving too fast. Some people have chronic conditions like Meniere disease. And that is a problem in the liquid, that it becomes too thick. So then people have balance problems like on and off all the time. There's not much you can do about that. Besides, same thing, just being careful and strengthen our systems. We're going to talk about that later. Another situation that can happen, I'm just listing some common situations, will be a vestibular schwannoma, which is basically a little tumor that happens on the nerve. And the prognosis for that can vary a lot. I had, actually it was an interesting story. I had a couple of patients, they were neighbors, they both live in Princeton. They knew each other, they had the same problem, the same surgery. He did great. Like in a month, he was working on his yard, cutting up trees, all of that, like no problem. Sometimes in the dark, he would get a little imbalanced, but for the most part, he was doing great. The lady, though, she didn't. She was always feeling imbalanced. She used to describe to me that she was walking like if their feet were glued to the floor, but she never fall because we couldn't fix that because when they took the nerve, the tumor off, the nerve got caught. So but at least we were able to work on getting her stronger and compensate for that so she wouldn't fall. So in other words, she would walk scary, but she never fell. Now, I talked earlier about how the eyes are important for balance, and I was talking about how that reflex maintains balance too, right? I can move my head, I can walk around, keep my eyes on a target without feeling like everything around me is moving. Sometimes when people have vertigo, very intense, or for a long period of time, or on and off all the time, that reflex gets impaired, even if the vertigo is gone. So many people come to the clinic, they tell me, I had vertigo a month ago, I could never get an appointment with my doctor, and then they sent me here and I had to wait 1 more week or 2. So now the vertigo is gone. I'm not spinning anymore. But every time I walk, I feel like I'm going to one side. All the time. I can walk in a straight line and then I'm kind of going, and then if I turn too quick, I feel like I still go to the side, like I can't really control that. And that sometimes is because of that reflex, right? If I move and my eyes didn't stay on the target, again, I'm going to feel very imbalanced. Actually, there's something also interesting. When I'm doing tests on bedside to see where the person has vertigo, I can't really see the inner ear, right? But if the person is dizzy and I can elicit the vertigo, I can see what's happening on their eyes. I always tell my patients, I don't care how scared you get, while I'm doing the test, please keep your eyes open. Because that way, I'm gonna see, let's say I have vertigo here, right? I'm gonna see how your eyes are taken that way, almost like windshield wipers. Imagine a cartoon, they got hit on the head and the eyes are going around. It's kind of similar to that. And during the test, I have to see if I turn you this way or that way. Different tests will give me different eye motions. And by doing that, I can figure out where in your inner ear is the problem. It can also, in some cases, help me figure out, is this on the inner ear or is in the brain, according to how that eye motion happens. So that's why, again, that's why eyes are so important when you do a vestibular exam, right? It's not only about checking the inner ear. Usually my second part of my examination is see how your eyes are going to move. Remember, I also talk about joints, right? And how my ankles can help me with balance. I said that there are some people that have chronic conditions that might not get better when it comes to their inner ear. But if we can strengthen other areas of balance, like that lady who looks scary but never fell, right? I can, again, compensate for what's happening in your inner ear. And something I like to explain to my patients in the clinic, I always give them the example of the boat. Imagine you're in a boat, right? Standing there looking at the horizon, beautiful day, and the boat starts moving a little. What am I going to do? Ankles, right? My ankles are going to sway back and forth to keep me balanced. Wind's picked up, waves are stronger, higher. I don't know the terminology when it comes to sailing, but the boat is moving more. I'm probably going to start moving my core and my hips, like, oh, this is getting a little rowdy, right? What if it moves even more, right? I'm going to start catching myself according to where I'm losing my balance. And we all do that sometimes, right? We were walking, we lost our balance, and poof, we have to take our foot out to prevent a fall. Those are balance reactions. However, I need flexible ankles to withstand the boat, right? I need strong hips and strong core to withstand the boat. I need to be able to quickly move my feet in whichever direction I'm losing my balance, right? And sometimes that just comes down to flexibility and strength. That's why many people that come to the clinics to work on balance, regardless if they have vertigo or not, they have to work on getting more flexible and getting stronger. Imagine yourself, if you're walking on uneven terrain, you need your ankle to adapt to that terrain, and if your ankle is too stiff to do that, then you're going to be imbalanced, you're going to trip. Again, that's why it's so important, so even if the vestibular system is a little off, to work on other parts of your body. Remember I said too, we have those receptors that tell my brain about how my joints are positioned? I said that they are everywhere, but they are mostly on my ankles and my upper neck. So there's a condition that we call cervicogenic vertigo, or vertigo that comes from the neck. If my neck is stiff, if it is painful, for example, like when I am in a car accident, I get whiplash, everything is going to get tight. So those receptors are not really telling my brain where my head is. And it's kind of not funny, but sometimes people report that they feel like their head is not connected to their body when they have that problem. Right? And again, it's because if my inner ear tells me how I'm moving my head, my neck will tell my brain where my head is after I moved. So if that is off, people experience a different type of vertigo. Their room is spinning when that happens. It tends to be more like a tunnel vision, blurry vision, a headache, right? Very, very, very stiff. So, and mostly when they lean over to pick up something, they feel like, oh, they kind of feel like a fainting sensation or a loss of balance. Luckily, when you have that problem, many times all you need is a good neck massage. Yeah, so that's the most fun or comfortable type of therapy for people. They just go and they get a neck massage and a few exercises, and they usually are fine after a while. It's not as quick, though, as the other vertigo. The other vertigo with the crystals can be awful, but usually get fixed in a couple of sessions. Something that I tell my patients, though, it happens sometimes that they have vertigo, let's say, for a month, and now they know, oh, if I move my head to that way, I'm going to get dizzy, so I'm not going to move anymore. So they get all stiff. They didn't have a neck problem before, but now they do. And they're like, I'm fine, I don't have vertigo anymore. Yeah, you don't have it because you're sleeping on a recliner, so you don't have to turn your head, right? And you're not moving. You're just walking like a block. So obviously, you're not going to have vertigo. So for me to fix it, I have to trigger the vertigo so I know which ear it is, and which canal. I mean, I don't know if you remember, but there was that little snail had 3 canals going around. Depending on where the crystals are, is how intense that vertigo is going to be, or what position is going to trigger it. So I have to figure it out. So I have to say, I'm sorry, Nancy, I have to get you dizzy. And they're like, no, don't touch me. I come here to get better. And you're going to make me dizzy. And well, there's nothing else I can do. I can't just go and look. And even the treatment involves getting you dizzy. So I'm very clear right now to tell them, maybe you're going to feel worse today, but in 2 days you're going to feel better. And I do that because early in my career, early when I was practicing vertigo, treating vertigo or patients with vertigo, I would get phone calls later, like, I feel way worse. I don't know why I went to see you. And then I remember, like, oh, maybe I need to explain them that they're going to feel worse, but they're going to feel better afterwards. And once I explain that, they know what to expect, and they don't yell at me. They come next day and tell me, I felt awful for that night, and I was cursing at you, but now I feel so much better. Thank you so much. I brought you cookies. So I get actually a lot of cookies when I treat people with vertigo because, again, they thought they had a brain tumor, right? So if somebody in one session move your head back and forth, and now you're good, you're going to give that person cookies. I mean, I would. So I told you all this information about my brain, about the inner ear, about neck, about joints, and I'm sure some of you are thinking, okay, I have that. There might be one of you there thinking, I have all of that. Right? So what do I do with all that information? How do I take care of myself? Because again, it can be so debilitating, and who's going to help me now? Can I help myself with this? And sometimes all you have to do is wait it out. So if I know, I think I said this before, if I have lightheadedness, I don't have vertigo, but I have lightheadedness, and that happens to most people. If I'm laying in bed on the recliner and I know that when I get up, I'm going to get dizzy and I'm going to stumble a little, one day I almost felt like I was fainting, then just wait. Wait 20 seconds, 30 seconds. Sometimes there's not much you can do than just wait, and if you have a blood pressure issue, for example. Sometimes people have high blood pressure, they take medication to get it lower, so sometimes your heart takes a few seconds to catch up to the new position. So you're not going to get rid of your blood pressure medications just because you don't want to get dizzy when what you can do is wait it out a little. Right? As I said, sometimes there's not much you can do except wait it out until you don't feel lightheaded anymore. If you actually have vertigo and you were fine, but you went and lie down in bed and the room started spinning, don't try to get up. You already triggered it. If you get up, you're going to still be spinning, but now instead of being safely in bed, uncomfortable but safe in bed, now you're still dizzy and spinning while you're trying to move, right? That's a fall that is going to happen. Usually, at least the crystal vertigo, it lasts from 10 seconds to 2 minutes sometimes, depending on which canal it is, right? So again, you either have to wait for a few seconds or wait for a few minutes, then get up, ask for help, see if you can call your primary to get a referral to therapy. Most physical therapists most clinics have a vertigo specialist on their staff. They can see you. And then from there, if some things don't match, right, then you can be referred somewhere else. Unless there are other signs that you can be like having something more severe, right? If you go online and look for treatment for vertigo, you're going to find some stuff like the Epley maneuver and other maneuvers. That is basically you lay down, you turn your head, do this, do that. Back in the day, we used to give that to people as homework. Research has shown that if you do it on the wrong angle, the wrong side, or the wrong timing, you can make it way worse. Sometimes there's a canal, the most common, there is the posterior canal in the ear. It only lasts a few seconds. But if you do that maneuver wrong and you send it to another canal, that gets so intense that that's when people end up in the hospital because it just doesn't stop in a few seconds. And usually those are the people that will vomit because of the spinning. So don't try it at home. It might look easy to do, but you have to figure out where it's coming from. And even if you manage somehow to figure out where the vertigo is coming from, you have to have the right angle and the right timing for the maneuver. So again, don't do it at home. Even if your friend who had vertigo before did it. Remember I said about my eyes staying on a target, and sometimes that gets messed up? Sometimes we do a simple exercise as grabbing a pen and shaking your head side to side to retrain that reflex. Sometimes it's just sitting, standing, walking, depending on how impaired things are. But again, we can work on your eyes if that reflex got impaired. And the way it gets impaired can be pretty interesting. If this ear is firing and telling me I'm spinning, but my brain knows I'm not spinning, my brain is going to be like, I'm not going to pay attention to you anymore. Just like that annoying family member that keeps complaining about everything, and at some point we stop listening to that person, my brain can do the same to my ear. But then the vertigo is gone, but my brain refuses to pay attention. So I have to kind of cue my brain again, okay, your ear is fine right now. You can actually listen to that ear again. And that's what that exercise is doing. Retraining the brain through my eyes to pay attention to my ear. That gentleman is there standing on a foam pad, and he's trying to work on balance, right? As I said before, if sometimes I can only do so much for the inner ear, I can work in getting you to work on different surfaces so you can improve your balance. And you don't have to have vertigo to have a treatment like that. If you notice that you're stiff and weak and you're having a hard time walking or standing, in therapy we have to put you through exercises and positions that are difficult for you to do in order to improve your balance, right? And that's the risk. How do I work on improving my balance? By doing dangerous exercises, right? You need somebody with you. And a corny phrase that I tell to my patients, and I know it's corny, but I tell them, I'm trying to make your therapy hard so your life is easier. And again, it's corny, but people understand then, oh, why are you torturing me like this? Well, see, flexible ankles, right? And work on also getting flexibility in your upper body and in your neck. As I said, a stiff neck can cause dizziness. You see that gentleman down there, I mean, it's a cartoon, but you see him turning the head side to side, different directions, right? And that's something that we should have, right? If I'm in the supermarket and somebody calls my name, I will turn my neck, and then I will turn my body if I want to engage, right? I don't move as a block. Hi, right? No, I turn and then I look, right? And then I keep going, I keep walking. Sometimes with age, we tend to lose that ability. Sometimes because if we feel that our balance is off, we tend to get all guarded. There are some neurological conditions also, like, for example, Parkinson's, that people tend to lose their ability of dissociate neck, upper body, and rest of the trunk. So many times by retraining that, you can improve somebody's balance. Just like move your arms when you walk. The reason we do that is also for balance. If I walk, again, as a block, and I turn as a block, when I lose my balance, I won't be able to catch myself. I'm just going to go. And go to see your physical therapist, right? You can have any balance problem, vertigo-related, not vertigo-related, neuropathy, any neurological condition. Maybe you're just weak, but your PT will be able to tell you where the problem is so you can work on it. Sometimes, I have a big copay. Sometimes you can go sporadically. I have patients that see a trainer, and they only come to see me every couple of weeks. And we say, okay, you're improving on this, now you need to focus on that, and then they go to their trainer, and they spend sometimes more time than I will spend in a therapy appointment working on their exercises. And then they come back to see me again, and then we calibrate what we need to do. Okay, so don't feel like you have to spend too much time with us or invest too much time with us, because technically our job is to find where the problem is. If you were hospitalized for a while and they discharge you with a walker and you don't want to walk with a walker, you want a cane or nothing, right? Don't just throw it away without telling anybody, because they gave you a walker for a reason. They gave you a cane for a reason, right? Go to your PT so you can actually work towards that goal. Your PT might tell you, please don't get rid of the walker. We cannot force you to keep your walker or your cane, right? You're all adults, that's your decision. But our job is to inform you of the risks, but most importantly, to work towards your goals, no matter how high they can be, okay? That's our job, to help you get better. And what I tell all my patients, regardless what you do, just don't fall, okay? Just don't fall. Don't give me more paperwork in the clinic. Just don't fall. Thank you very much. I think there's a Q&A section, or is that for afterwards? Oh, okay.
So, check, are we on? There we go. I'm going to give you a second. If those of you who wish to rotate, go ahead and rotate this way. Or perhaps grab a little sip of water. Hydrate. Turning. What's that? Rotating, not twisting, right? Shake out all the parts that got, a little tight sitting there. So I also share something in common. I just met Pablo today, and that is amazing information. I thought it was spectacular. And we have something in common, except he experienced it earlier in life. I experienced it recently, in the last few years. I, too, have experienced vertigo and went, oh, what is wrong with me? And I experienced it for several days. And it's terrible. If you ask me on a scale of 1 to 10 what the pain was, I'm going to tell you it was a 30. That's how dizzy I was. I was spinning in a bed that was perfectly still. Didn't feel like it. It's a terrible feeling for those of you who've had it, yes? Yeah. So Pablo mentioned there's some really great ways to kind of build up after that. It sounded an awful lot like exercise to me, yes? If only there was a place we could go that had exercise. Maybe a gym or classes. Oh, wait, we have those here, right? So we can exercise. Classes here, classes through the gym itself. So I got to thinking, so those of you who know me kind of know that thinking is my, my unsuperpower. I got to thinking that I was probably dizzy for about 10 days straight. And it went from here to finally the last few days, maybe I could drive, but not for long. Why did I not fall that entire time? And I could not get out of bed the first 2 days. Physically could not move. Why did I not fall? But I thought to myself, I know why I didn't fall. I exercise. I had strong body parts. Pablo mentioned ankles. How many people here have heard me say you cannot bend your knees if you cannot bend your ankles? Right? Cannot bend your knees if you cannot bend your ankles. I had a conversation with someone here, actually Dominic. Anybody here ever seen Toy Story? Okay. First one, Buzz thinks he can fly. And what does Woody tell him he's actually doing? He's falling with style. Technically, that's the definition of walking. Falling forward, right? But I'm stopping myself. The strength of my legs allows myself to stop myself as I'm falling forward. Does that make sense? Walking is falling. Running, in particular, is falling with style. Falling with control. But we don't just fall forward. When you're dizzy, you can fall anywhere you want. Wherever your body gravity takes you. Right? What stops me from going all the way to the floor? Strong hips, strong glutes, strong thighs, mobile ankles. So let's make our ankles mobile. Oh, first of all, how's your posture? Wow. I can tell who was done classes with me before. There's a whole lot of wriggling going on real quick. Sitting up nice and tall. Stick one foot out in front of you. Push your toe to the floor. Pull your toe up to your knee. Push your toe to the floor. Pull it up to the knee. Is it moving this much, or is it moving this much? Or is it not moving at all? Try the other foot. Push the toe down, think like a ballerina. Pull that toe up. Push it down. Pull it up. Push it down. How long did that take us? 8 seconds? Could you do that a few times a day? Absolutely. Let's progress that a little bit. Push your toe out. Don't move anything but your foot and make big, giant circles with your foot. And then go the other way. Switch feet. Well, I like the feet I have. I'm not going to switch them. I'm just going to do the other side. And then circle the other way. Good. Do you feel that anywhere besides your foot? Maybe in your legs. Yeah. That might tell me we're using something in there. We might be stimulating some muscles in there. Right? Could you do this, little circles with your feet, to make yourself stronger or more flexible ankles? And then when our ankles start to work, maybe our knees will start to work too. One more movement for you. Ready? Sit up nice and tall. Make sure there's space in front of you. I'm going to do it with you. Hold on, let me grab a chair. So far I have not made anybody leave the comfort of their chair, correct? Sitting up nice and tall. So I can make those toes come up and down. Like my toes are just tapping. Music's optional, right? And then make your heels go up and down. I also have really good hearing. There you go. So now make your heels go up and down. So what did Pablo mention is also involved in that control of our bodies, that vertigo? Your brain, right? Can you tap your right toe? Good. Switch, tap your left toe. Go back to your right toe. Pause. Tap your left heel. Tap your right heel. Left heel. Pause. You ready? Some of you are laughing at me because you know what I'm going to say. Tap your right toe and your left heel at the same time. Aha, isn't that fun? Ready? Here's the fun part. Switch. Even I didn't get it. There we go, switch. So little brain function going on there, little cognitive function. How do I tell messages from here to do something down there? And the messages here come up. So we can exercise our brains just as much as we can our bodies, and at the same time, even better, right? We're all still sitting tall? Take your left foot and push it into the floor. Yeah, you all got about a ½ an inch taller. That's good. Pick up your right toe. Now pick up your right knee. Lift it up, up. Little single leg march. Up, up. Switch sides. I'm pushing this foot into the floor. That's providing me a little stability, making me taller too. I want to be taller. Good. Feel like you're using your legs a little bit? Good. Take a look in front of you. Do not kick your neighbor, unless you're related. Lift up and push your heel out. Now, we never do anything that hurts. If it hurts, don't do it. That's not my department. That's his department. Pull and push. Pull and push. Hold that out there. You feel that? Up in your leg, little lift. Can you lift it up? Good. Switch sides. Lift the toe. We all do what we can within our ability, right? Lifting and pushing and pulling. Out and in. Out and hold. Can you lift your toe to the ceiling for 4, 3, 2, 1. Are we still in our chairs? Did I make you do anything really hard yet? Not yet. Not yet. There's always time, right? So we can do these things seated. We can work our legs a little bit. That leg strength is going to be important to stop the fall. So you're going to see Pablo, maybe before if you feel like you're weak or inflexible. And like he said, he can say, hey, this is what you need to do, and then go work with a trainer. Do you know any trainers? Do we know any? Oh, wait, that might be me, right. You might know one. Then work with someone to get stronger. But chances are, you're going to go see him after you get the vertigo, after you've had a fall, after you've gotten hurt. And if we can get stronger before then, you can go see him because you want to, not because you have to. Right? So I'm going to step nice and tall. Some of you have arms on your chair, so you might not be able to step as far, but if you're able, just step out and step in. Think stepping out of the car, stepping out of the bathtub. So just one side. Yep, just a little step. Good, let's do the other side. Now, I really want to have strong hips. That's going to help me if I lose my balance and I'm falling to the side. Maybe I can step out. So, let's do something really, really slowly. Ready? Take this foot and move it out super slow. How slow can you go? Yeah, pretty slow. Almost like you're not moving, right? So we're going to go out and back in. Is stepping slow like that going to help you in a fall? No. That's stepping slowly is not going to help you if you feel like you're about to fall, correct? Now, it'll help you getting up if you feel a little dizzy, but it's not going to stop you if you've lost your balance. What do we need to stop ourselves from falling? I heard it. Speed. Speed and power, strength. So when I say 3, step your right foot out just a tiny bit. Ready? 1, 2, 3. Bring it back in. 1, 2, 3. 3. Good. Let's go the other way. This time the number will be 4. 1, 2, 4. Good. 1, 2, 3, 4. 1, 2, 3. Saw that. 4. Good. We want to have that speed. And this is great to practice seated, but these are things you can practice standing with support. So there's one, I also heard this, I'm going to ask a question. How many people here feel like they could stand on one foot for more than 5 seconds? Switch feet, if you had to do it on the other side. Could you do it? How often during the course of your day, the course of your week, do you feel like you need to stand on one foot? I have people come to me and say, I can't stand on one foot for 30 seconds with my eyes closed. And I say, who cares? Is it a functional thing for you? Now, it's a great assessment for me, for professionals to do that, to say, hey, can you do that? But does it matter in your daily life? Wait, I'm going to talk to you for 30 seconds, just like this, with my eyes closed and my hands out. Do I need to be able to do that? No. I do need to be able to stand up, though. I do need to be able to stand on one foot when I do what? Stairs, I heard it. Ready? 1, 2, step on the step. 1, 2, oh, wait, there's a little wobble, step on the step. I do need to be able to pick up my knee and stand on one foot for a few seconds, but I don't need to stand here for 30 seconds with my eyes closed. That doesn't mean we're not going to do it on a professional level to test you, to challenge you. We always work harder than we need to, so we need those muscles, brain and body, that they're there and they're available to us. When else do you balance on one foot or almost one foot or a part of a foot? Walking, correct. So if I walk normally, 2 feet on the floor, 1 foot on the floor, 2 feet on the floor, 1 foot on the floor. At some point during that walk, I'm on my toe and my heel. Yeah, can you do that for 2 seconds? So we want to make sure our legs are strong. We do have good balance. We also want to be able to stand. If I had bad balance, would I want to stand here and talk to you? Probably not. So there's an exercise you can do, and I'm not going to tell you the name of it, it doesn't matter. So I'm going to stand, pretend this is a wall, and I'm going to stand between the wall and my chair. If my balance is challenged, I can practice here and just hold with both my hands out. Why do I want a chair and a wall? Right. The wall will push me forward, the chair will keep me up. I might even want a little higher chair, something definitely stable. Not your office chair with the wheels on it. And that'll be a different thing. So I want to be, this is a great thing to practice, right? Pablo had a great slide. Taking that back foot and pushing that knee forward. I'm still holding on. Now I'm practicing that ankle flex that I just had you do seated. You could do it with a little help here. I could use a wall. These are really simple things. How many people here brush their teeth? Good, excellent, good to know. Could you do this while you're standing brushing your teeth? Right? And then when I switch feet, you ready? Really want to challenge your balance in your brain? Switch hands, which hand you brush your teeth with. Just don't do it just before the dental visit. Hygienist will say, what do you got going on in there? Say, oh, I'm practicing my balance. Then you have to explain the whole thing. Okay? So you could practice bending your ankle. Is that more practical than standing like this? Probably. Probably. I do need control. I need that core control here. Right? Your core is everything from here to here, front, sides, and back. Can everybody brace your core? If I were about to punch you in the belly, what would you do? Oh, right? Or a puppy or a toddler come running at you. Da-dum, da-dum, da-dum. Oh, brace your core because they're going to jump on you, right? So that's a brace. Feel that. Brace that core while you stand. It's going to help here. Because if you can't control this, you can't control this. All right? All right. What else can we do? What can else we do balance? Anybody here who wants to? You do not have to do this. Dominic handed out, have given you a bunch of flyers from UMass. One of them is about sitting to standing. Okay? The first part of that direction says to sit on the edge of the chair, right? Come forward in the chair. Okay. It is, especially if you're not as strong as you'd like to be, very challenging to get up from way back here. Oh. Sound effects are optional. It's hard to get up from there. Coming to the front of your chair. If you want to do this, you feel safe enough to do this, you can do this, you can hang onto the table. Tuck in so your knees are over your toes. Sitting up nice and tall, a little lean forward. What's the direction say to do next? Breathe. Breathe. Those are my people. Where are you? My class people. Breathe. Breathe. It does say to breathe. Those of you who take my seated class, what's rule 1? Breathe. Rule 2, don't fall out of the chair. That rule still applies here, okay? I'm gonna hinge forward, push my feet into the floor, and rise up. Excellent. And then sit back down. So, does this look like a great way to get up? Because when I pick my back end up, this end is lower than that end. And somersaults are next week. That's going to be the tip forward. Okay? Does anybody get out of it, sit down at any point during a day? You've all done it once today. Do you stand back up? Yep. Yeah. What if you did it 2 or 3 times every time you get out of a chair? I'm sitting and eating my breakfast. I'm done. I'm going to stand up once, twice, 3 times. Right? A little extra. Little extra. There's another place we all usually sit a few times a day. Don't do this there, okay? When you've got clothing wrapped around your knees or your ankles, okay? This is one we do fully clothed with support of something to help us if we need it. So we can stand up several times a day, right? Does anyone have stairs in their home? How many people think the stairs is the worst things ever invented right now? Yeah, knees, hips, ankles, all bothering you, right? What if every time you went up the stairs, to have everybody have handrails on their stairs, use them and do this at the bottom of the stairs. I'll demonstrate over here. Okay. Holding my handrail, up, up, down, down. Now I'm going to go up the stairs and go where I'm going. I did 2 extra stairs, right? If I did that every time I went up and down the stairs, Got a little extra. And I also did what? I went backwards. Anybody here practice walking backwards? If you're in my classes, you better be raising your hand, right? Because backwards. What's that? Your first day here. Then you can come to class and we can practice walking backwards. Okay. Mm-hmm. Yep, absolutely, exactly. If you're a skier, you need to have that knee bend, those knees over toes. That's a good thing. And even if you're not a skier, you're a human being, which is even more important than being a skier. And that's how we motor locate. That's how we move from one place to another, is by using, if we can, our legs and our muscles. Largest muscle in your body, right here. Use this muscle and this muscle together, the two biggest in your body. Use them, right? The big brain and the big butt. We're going to use those to help us to get ourselves back up. And the extra stairs. So Pablo talked about neck mobility. Every time I teach a class and I say, what do everybody want to stretch today? What's the answer? Neck. Everybody wants to stretch their neck. Okay? So let's do the ones that Pablo had outlined on his slide presentation. So sit nice and tall. I'm thinking about having my ears right over my shoulders. I really don't want to be in this position because that already hurts my neck. I want to bring that chin in, almost like I'm going to make a quadruple chin on purpose, right here. Okay. Nice and tall. Inhale. Exhale. Relax the shoulders. Inhale. Exhale. So this time when you inhale, turn and look as comfortably as you can to the right. And exhale back. Inhale to the left. And exhale back. So think about if I had a shelf here, I'm going to turn my head across the shelf and come back and go the other way. Good. This time when I get my head over to the right, I'm going to drop my chin like I'm tracing the collar of my shirt down and back up the other side. And then I'm going to look down and go back the other way. Does that feel good? Feels pretty good. I'll do one more each way. Inhale up and exhale down. Good. Come back center. Keep your nose right here. Look up. Look up to 12 o'clock. Look to 9 o'clock. Don't turn your head. Look to 3 o'clock. Do you probably like my vestibular exercises, moving my eyes? Are those good? Those are good, okay. So, can I look up like it was 2 o'clock? Look center, then look my eyes up to the 11 on the clock. Good. Moving your eyes, giving your body signals, right? But moving that neck. Relax, take another big breath. Shake it out. Feel your head lift, your shoulders drop. So I'm going to put this down for a second. Take your right hand and hold the side of your chair. Lift up your neck, your head tall, and then just start to tip your head. Remember rule 2, do not fall out of the chair. Tipping over a little bit. I can add a little bit of a drop here to my shoulder, right? And I might be able to help it a little bit. Give a little push down. It's fascinating to me that the human body, as we get older, everything goes down with gravity. Except our shoulders, like do this. We need to help them go down. Even everything else is going down. We want the shoulders to join. So I'm going to give it a little help, push it down. I would have my hand here. Let's grab the chair on the other side. Nice and tall. Drop your ear to your shoulder. Good. If it feels good. Shake all that out. Put your hand on your shoulder. We haven't even left, besides just standing up, we haven't left our chairs. We're right here. Can you lift? It is cheating if you bring your nose to your arm. Can you bring your arm to your nose? And do the other side, arm to nose. Could I do that a few times a day? Sure. Shake those out. You're going to do this. I'm not going to do that because it would probably sound terrible on the microphone. Okay. Let's do the other side. I'm going to do the other side to catch up with you. Good. Are we still breathing? Oh. See my classes? That's how it's done. When you ask people if they're breathing, they say yes. So that's how I know you're all breathing. Good. How are we feeling? Okay. We're going to do, I'm going to put this down. It's kind of what I do, you do. Inhale up. If that's not your range of motion, just come here. Maybe lift your elbow. Do it again. Inhale up. Exhale down. How are you feeling? Feeling good? So Pablo talked about mobility. What does mobility mean? Movement, the ability to move, right? How many people have touched their toes today? How many people have seen their toes today? Ah, they're down there, even if you have sneakers on, okay? How many people would like to touch their toes today? How many like the idea of touching your toes today? I like the idea of touching my toes today. Take your right foot and stick it out in front. Pull that toe up towards your bent knee. Lift that spine nice and tall. Do y'all remember the Charlie Brown cartoons? Charlie Brown had a kite. Looked like this.
Whenever he got it up in the air.
Yeah, if he ever got it up there. It was just a diamond shape, right? Tall stick, wide stick. Tall stick is your spine, from the base of your head to your tailbone. Think tall spine, and then think this is the crossbar. Don't collapse his kite forward, don't collapse his back side to side. So that foot's up in the air, right? And then hinge a little bit from the hip. That means don't collapse the kite, okay? Can you reach? I have my foot on the floor, it's a little easier, so I got some pressure on there. Let's pause, let's come back up. Can you touch your thigh? Simon says touch your thigh. Simon says touch your knee. Tip shin maybe just below the knee. If it feels good to you, reach those fingers and reach towards your toes. Wait, pull the toe up, that helps. You gain about an extra 2 inches there. There's where your ankle mobility helps too. Lift that up, now I can touch my toe. Okay, let's do the other side. You may have different mobility on the other side of your body. Okay, that's kind of normal. Pull that toe up, nice tall kite. Hinge from the hip. I can touch my thigh, my knee, maybe my shin. If I'm feeling good. It's actually a little bit easier to touch my toe maybe than my ankle, but touch my toe and come back up. If you couldn't do that today, and that's okay, right? What could you do every day for the next 30 days? You could practice that. And maybe in 30 days, you can reach just a little bit farther, right? Wouldn't that be good? All right. Put your tiptoes on the floor, lean back in your chair and get comfortable. Do a little shake of your hips side to side. Okay, all right. If my hips are stiff, this is hard to do. We want them mobile. So I'm gonna sit up nice and tall, put one hand on my knee, so whichever side I'm choosing, I'm going to use that hand to help lift up my leg. So I'm going to grab that kneecap and lift and pull up. Let's make a few circles with your knee. And go the other way. Good. Put that one down. Let's grab the other side. I'm going to pull it up. And if you can't, see if you can move your knee without the hand. Good. Okay. I'm going to lean back again, put my tiptoes on the floor, and then shake my knees a little bit side to side. Again, the chairs with the arms might make that challenging. All right. Working on taking a tension out of my hips. And I've asked you to do something several times today, and it's probably one of the more important things, well, it is the most important thing you need to be able to do, and that's breathe. If you're in pain or tight, you're not going to do the exercises because it doesn't feel good, right? So I need to loosen up a little bit. So inhale. And as you exhale, think, just sink down. You can even let your hands sink inside or outside your legs. Inhale. Do it again. Let's move our hands. Inhale them up. Exhale them down. Good. So what have you heard no one tell you how to do today? Someone asked me if we're going to do this today. I heard it. How to fall. Why? Why are we telling you not teaching you how to fall? Because we're not going to fall. We don't want to fall. We don't want you to fall. However, if I do it while I'm rigid, did we fall and break something? Yeah. We're going to relax a little bit. Don't fall. We don't do fall here. We do autumn. We don't do fall. Okay? Don't fall. Suki, all you? Yeah? Yeah, we can do Q&A. Do you want to do Q&A? Come on up. Don't fall and exercise. That's my answer. Breathe. Don't fall. Exercise. Done. I promise I didn't spit on it or lick it. Okay. Questions, anyone?
We have one right here.
Pablo, what about people with tinnitus? How does that affect their balance?
Tinnitus doesn't usually affect your balance, but is related to conditions that affect your balance, right? Like sometimes people have tinnitus when they have Meniere's disease, right? It's like a side effect of having Meniere's disease. But tinnitus per se might not necessarily affect your balance. Now, I have some cases when people have tinnitus because they have very tight muscles around their neck, particularly the ones closer to the ear. And sometimes working on that tightness can decrease your tinnitus. And as I said in the presentation, if you have a tight neck, that can impair your balance. You are doing the right thing, as you said, to just wait it out. But I don't know, have you ever gone to therapy to get it checked? Because that would be a good alternative, because what I tell my patients, if I can find which ear and which part of the ear the vertigo is, if it's that type of vertigo, right, you only need a few sessions to actually correct it. But some people need one session, and done, and that's why they're all happy. Other people might need a little longer, but they usually get better gradually. So I would advise you, if that's your question, don't wait. I know you're managing the best you can, and that's great. But also, even if you need have a consultation and people tell you, I can actually help you with this grade, or no, just keep doing what you're doing. Yeah, that is true. People have different types. One person can have all of them sometimes. You just have to figure out then which one is the most debilitating at the time, work on that one, and then move to the other ones if you can address them.
I wanted to know if you have ear infection several times and at the same time you feel dizzy while having the ear infection, is that means you got vertigo?
Yeah, sometimes that can happen. If you have an ear infection, it usually tends to be outside in the outer parts of the ear, but sometimes it can travel inside and cause inflammation. And then you either have the inflammation that will cause you dizziness, or sometimes the crystals will get loose because of that inflammation, and then you will have the type of the crystals bouncing around. Yes. Because the antibiotic could have got rid of the inflammation, the infection, but didn't get rid of the crystals bouncing.
Are you more inclined to get vertigo as you age?
Yeah, you are more inclined to get vertigo because one issue with vertigo is, as I said, the crystals get loose, but they get reabsorbed, right? And as we get older, we kind of have trouble with calcium reabsorption. That's why we have osteoporosis, for example. Right, so that will be like a similar type of condition. Also, there's some research that is saying that in some people, when they lack vitamin D, that can also impact calcium reabsorption. Therefore, they might have vertigo, and it's actually very, very common. We tend to see that at the clinic on the winter months. Around February or March, we get an uptick in referrals for BPPV. Some people are very sensitive to motion, right? Have
Okay.
you seen those people that cannot be in the car in the passenger side or in the back
Right.
of the car? Sometimes it can be related to that. I can be like that too. If I don't do well with vertical motion, so I'm the person who, if I can avoid an escalator, I do it because I immediately feel that my body tenses up. But that is
Okay.
because I'm hypersensitive to that, more than having a vertigo problem. But if I have been having vertigo for a while, that will make me hypersensitive to motion.
Okay. And my other thing is, would a CT scan of the brain with dye indicate one of these conditions? Could it would that be used to diagnose, I should ask?
Probably not for the inner ear itself.
Okay.
Right? If what happens is there's certain, I was saying earlier that there's certain patterns on how we watch the eyes move. And there's something called nystagmus. I think I said that if I trigger the dizziness, the eyes should move in a certain way. And as crazy as it looks, you learn how to identify what direction and if it changes or not, right? So we expect to see something according to how am I doing the maneuver. But if that doesn't match, and there are other signs, they might be like this vertigo might not be coming from the inner ear, then you might need to go to see a neurologist. And then they will decide what exam is the best.
Okay, thank you.
The Meniere's disease is a whole change on the system itself. That the vestibular system inside has this liquid, right? And according to how viscous it is how things are going to get conducted, that information. So it's basically like there's a degeneration of the whole system inside. That's why it ends up affecting nerve and the conduction towards the brain. So it's not only where you're hearing, you start losing your balance too, and that's why then the tinnitus comes in too.
Thank you.
Well, they can be related or unrelated, right, depending on the condition. Like if you have Meniere's disease, right, you will have tinnitus, and because of that condition, you will have a balance problem. It's not always related that the labyrinthitis will give you tinnitus, though. They could be two unrelated situations.
In your statistics, have you found that everybody comes to you with a balance problem, ironically, they also have tinnitus?
Not necessarily.
Not 100%.
Not 100%. Actually, most people that have a balance problems do not have tinnitus.
No.
And people that have tinnitus, not all of them would have specifically a
And
balance problem.
Back to the question on nutrients or vitamins, you said vitamin D may help with this issue, but for complaints of highway balance or
Like driving
in
in the highway, you mean?
driving on the highway at highway speeds with the motion all around you, it relates to balance concerns.
Yes.
What exercise is good for that?
That has to do more with eyes,
Eyes.
right? We were talking about my ability to focus on one target as I move my head. There's another reflex that actually we see it a lot in concussions when people hit their head, that they tend to lose the ability of tracking different objects that move at the same time in your environment. So again, that's also related to eye emotions. So maybe that's the area to explore in your case.
And any particular foods that may help with balance related?
Fruits?
Food groups.
I don't know. Which one has vitamin D? Yeah, you can tell me that.
I'm a nutrition coach as well. I can tell you that one. Your vitamin D you're going to find mostly in your oily fishes. There's not a lot of it in our bodies make it. That's just why you see an uptick in February and March, because we've been kept indoors in the dark since November, and our bodies are not creating as much vitamin D. So we need a little bit more vitamin D in our diet. There is supplementation. You can have a conversation with your healthcare provider about what supplements you should or could be taking, and then again, the calcium absorption. That's important too.
Good. All right, thanks.
That's a tricky one because sometimes you don't know when it's coming. And you can have it at any time. So there's not, I wouldn't say there's a way to prevent the vertigo itself. And when I said, research shows that vitamin D can have, a lack of deficiency in vitamin D can lead to it. When I tell that to my patients, they always tell me, well, I take vitamin D. So I'm like, okay, then was that a reality? It's just research shows you that.
So what else is causing
Exactly. So it's multifactorial, so it's hard to narrow down what can cause it. I think you mentioned in your presentation that you had it, but you didn't fall. Exactly. So
I was strong enough not to fall.
exactly. So sometimes that you might not prevent the vertigo, but you might be able to prevent the fall or the accident from it.
Well, that concludes our wonderful program today. Thank you, Pablo and Rhonda. And now we welcome pianist Pam Hines, and lunch will be served soon. Thank you again.
Thank you.